Is going to focus on muscles of the shoulder and rotator cuff. We can see that this first image, this man has really well-defined shoulder, so his deltoid is clearly seen. So we're going to look at the muscles that are going to encompass this region, obviously deeper ones, but you can see fairly well his deltoid there. All right, so when you move your shoulder, your muscles are going to insert a lot on the scapula as well as our clavicle, because those two bones are going to encompass our pectoral girdle. So just so you guys are familiar with the scapula, if you elevate your scapula, you're moving it straight up, like when you shrug your shoulders up. And when you depress your scapula, if we look over here, right, you just move it back down into its sort of normal position. Now the scapula can also be moved in towards each other. So this movement is going to be a retraction or an adduction of the scapula. So actually that's pictured here. So if you see this man is pushing his scapulae closer together in this movement, so that's going to be retraction, or you can say adduction, ADD. The opposite, right, if you're trying to move your shoulder blades or scapulae further apart, that's a protraction or abduction, which is seen here when you're trying to move your scapulae apart from one another. So you'll see those in the actions of these muscles. So we're starting off with the most superficial muscle of our shoulder, which is our deltoid. The deltoid is a very broad muscle at its origin, so you can see that the origin includes the clavicle anteriorly. It moves across. This is going to be the acromion of your scapula, and then all the way moves. The acromion becomes the spine, so it's also going to touch the spine. So it has a very broad origin, and then it inserts in one point, and this should be familiar. This is the deltoid tuberosity of your humerus. And the fibers, you can see in this image that we have anterior fibers, we have lateral fibers, and we have posterior fibers. So depending on what fibers that you're using, you can move your humerus, right? This inserts onto the humerus, and so it's going to move the humerus. The action will include the humerus or the arm. So if you look at the whole muscle here, if you engage all the fibers, anterior, lateral, and posterior, you are going to abduct the arm. So you're going to lift the arm away from your body. If you're just using the anterior fibers, you can flex your arm. So if you're moving it forward to shake someone's hand, so you're moving your humerus forward, that's a flexion. And medial rotation, so if you're twisting your humerus in towards your body. If you're using the posterior fibers only, you can extend, so you can pull your arm back beyond your the 180-degree plane, and then you can also laterally rotate, so you're going to twist your arm out. That's called a lateral rotation. So this deltoid is called deltoid. The name delta or deltoid refers to the triangle. So if you were to take this muscle off the body, it would look like a broad triangle. So you have a very broad origin and then coming down to a point, giving the deltoid its name. All right, so we can see the deltoid here. Our next muscle is going to be pectoralis major. So pectoralis major is also a very broad muscle at its origin. So let's take a look. We have the clavicle. So it really takes up a lot of the clavicle. At its origin, it's going to move into the sternum. It's not going to include the xiphoid process. It's going to go around and then have an origin here on the costal cartilages. And then the whole muscle will insert into one single point, and this is going to be the intertubercular groove of our humerus. And so it's going to move, right? The insertion is going to move, so it's going to move the humerus. And if you look at the, these fibers are anterior, so if you're going to pull the humerus towards its origin, this is a flexion, so you're going to move your arm up like you're shaking someone's hand, but also in for an adduction. Medial rotation is also here because these fibers, again, if you look at the way they're oriented, the humerus can be twisted in an internal or medial way with this muscle. So it's very big. This is a muscle that most people know, your pecs. This is what that's referred to, so pectoralis major. The next muscle on the list is Latissimus Dorsi. So if you look at the two insertions for pectoralis major and Latissimus Dorsi, you'll see that it's the same insertion, but the Latissimus Dorsi is a posterior muscle, so that's kind of interesting. So let's take a look at that. So this is a very large superficial muscle of the back. So it's going to be on the superficial side of our diagrams. And if you look at the origins, right, it's going to be our lumbar vertebrae. So we're going to have our spinous processes along the lumbar vertebrae. Then we're also going to have the sacrum, which is going to be in this region, and ribs 8 through 12, which is going to be in this sort of fascia region here. And this very large swath of fascia is something that you're going to need to know. So that's called the thoracolumbar fascia, the origin of Latissimus dorsi. Then if you watch the muscle, right, it comes forward and it's going to sneak underneath your arm and then insert anteriorly. So that intertubercular groove is actually on the front or the anterior side of your humerus. Because of this, when you use your lats, right, when you use your Latissimus dorsi, it's going to move the humerus towards the back of your body. So if you are someone who works out and you go to the gym, they have something called pull downs that you can do. So you grab onto a bar that has weights on it and you pull it down. So you're taking, if you're extending your arms above your head and you're pulling something heavy down, right, you're moving your humerus from sort of an abducted position, you're moving it in, adducting your humerus. So that's one adduction. Extension is to move the humerus slightly backwards, right? So you're extending it beyond the 180-degree plane. And then medial rotation. So if you're twisting your arm in because it's coming in from the inside your body here, it can medially rotate your humerus. This is the trapezius. And we can see that this is, again, a really large superficial muscle. It has a really broad origin. So the origin of trapezius goes all the way down the back. And so let's start at the head. So the first origin is on the occipital bone. Then we're going to come across this structure called the ligamentum nuchae, otherwise known as the nuchal ligament. So this is this connective tissue right here along the neck. So this is a very strong fibrous ligament. It runs on the spinous processes of the cervical vertebrae. Now when the nuchal ligament disappears, the muscle continues on and it just continues originating on the thoracic vertebrae on the spinous processes all the way down to T12. So basically it encompasses all your cervical vertebrae and all the thoracic vertebrae. If you look at the fibers, right, they're all going to insert here onto the spine of your scapula. Then the scapula, right, is going to come up and it's going to go around. So this muscle actually does touch your clavicle. So it comes forward and there's an insertion point on the lateral clavicle. So we're moving from the spine to the acromion to the clavicle. Let's take a look at the fibers. So this trapezius is so large that it has fibers that are going to be up here, these superior fibers. Then you're going to have these laterally oriented fibers. Then you're going to have these inferior fibers. They're all going to do something different to your shoulder, right? So these superior fibers are going to raise your scapula. So they're going to elevate the scapula. So if you look at your actions, I dropped down a little bit. So in the middle of that box, superior fibers will elevate the scapula. If you look at, if you go one up, the inferior fibers are going to depress the scapula. So if you're just contracting these fibers down here, they're going to depress. And then these medial fibers there, they're going to move your shoulder, or say scapula, close together, right? So it's an adduction or a retraction of those bones. Bilaterally, so if you use your scapulae together, they can actually move your head, right? Because if you, this muscle has such a broad origin that, you know, your vertebrae don't move, but you can actually extend your head with it. So if you're going to move the occipital bone, it's going to pull it back or give you a head extension. If you just use one side of your trapezius, moving your head, right, you can have an ipsilateral flexion. So you're going to flex the same side that's contracting. So let's say this side contracts, you're going to pull your head to the same side as it's contracting. So there is trapezius. So these are both very superficial. And then we're now going to look at our serratus anterior. Okay, so serratus anterior is going to be here in the diagram. So this is another serrated muscle. So it's going to have our origins on the ribs. So because the ribs, again, there's a gap between our ribs, the muscle will look serrated or jagged. This muscle is superficial. So you can see on this side how we have the superficial side. In this region, the muscles the serratus anterior can be superficially seen. It will go back, right? It's going to hug the ribs and it's going to insert finally onto the vertebral border of the scapula. So it's going to move the scapula. And if you think about these fibers, they're going to start off anteriorly, they move backwards around your body. So when they contract, they're going to pull your scapula towards your anterior ribs. So that's a protraction. The serratus is also a stabilizing muscle, so this stabilizes the scapula. When you're moving your humerus around, sometimes you want your scapula to stay still. So if you try to isolate and not move your scapula, but still sort of move your arm, you are using your serratus to stabilize that scapula. Let me show you an image of serratus. This right here, right, this is her serratus anterior, and you see how she is reaching really far. So the ability to sort of extend your humerus or your arm out and up, that's the serratus anterior. If you look at the actions, it's to protract and upward rotate of the scapula. So this is sort of a beautiful example of that because she is using her serratus to really pull her arm to give her that really nice length that she wants in ballet dancing. And this, you know, it is a protraction. She's moving her scapula away from her midline, and she is upwardly rotating her arm. But it's because her scapula can be moved in this direction. So that's her action. So this is a really great image to think about when you think about the serratus anterior.